Uh, Welcome, everyone, to the third satellite, Section 10, entitled Dendrimer-based Nanomedicine, Recent Advances. I would like to thank, before we get started, thank Bert Leffler and Patrick Hunzinger for this kind invitation to organize this session, because it really gives me an opportunity to get together with some of the key people in the Dendrimer field that you're going to hear from this afternoon. But I really want to thank Bert for this big surprise, this good luck CLINAM dwarf, pixie or angel, whichever you would prefer, because I think it's a good omen that will take us into many successful Dendrimer-based clinical trials in the future. So I share it with all of you. So if you get a chance, rub it before you leave to make sure that good luck goes with this. Now, as I say that, it's not just luck that's required to get into successful clinical trials. It really is going to require some good, hard science and some good, honest effort. And this first part, before I introduce the rest of the 7 speakers in this session, I'd like to just take a few minutes to share with you my perspective on what has been missing and what maybe is required to get us to that wonderful world of human clinical trials. And it's a very simple recipe, and it really involves only 2 things: systematic engineering of Dendrimer quality, as well as critical nanoscale design parameters, or CNDPs, and I'll describe what that is shortly. But before we go there, I'm really compelled to say a few words about a really controversial article that came out last week that Scott McNeil has had to respond to as a defender of NCL and the nanomedicine effort. And it really came from a professor at the University of Toronto named Professor Warren Chang, and he reported in the Nature Review of Materials that, do we really know how to deliver nanoparticles to disease sites? Do we really understand the delivery problem? And I'd like to touch on that very quickly and briefly in my short time. And then secondly, I'd like to give you an update on another interesting controversial article this last year written by Zonka Svensson, who worked for me for a couple of years, only to correct some history that he may have written in that article. And then finally, we're going to hear from Professor Katia Ornelas from Brazil. And it's will be a young people's perspective on where she sees Dendrimers and what she feels we need to do to get to that next place called clinical trials. Now, in this paper last week, this was the provocative issue that was raised. And it was raised concerning, do we know enough about the microenvironment of cancer tumors? And it really had a direct bearing on a recent failure by Bind Therapies, wherein they found that they did not maybe have the right size nanoparticle to do the job. In fact, if you talk to the appropriate sources, you'll find that these extravasation ports or channels from the delivery of vessels, blood vessels, to the cancer tumor are approximately 20 nanometers in early phases of cancer. However, later stages of cancer, they get much larger, so the CPR effect can be used, or the EPR effect can be used, and you can use larger particles. But in the earlier stages, it is generally believed that the sweet spot is somewhere between 8 and 15 nanometers. You want it to be below this 20 nanometer size that was quoted by Professor Chang. You want to be above 8, because if you're too small, you will lose your nanoparticle in an excretion process through the kidney. So the magic size appears to be somewhere between 8 and 15. Let me back that up. 8 and 15. Now, how do I know it's 8? It's because physicians, when they have a compromised renal membrane, they usually look for albumin, which has a diameter of 8 nanometers. And so when you start opening up that pore a little larger than a healthy situation, then you start losing albumin. And so there's a very magical sweet spot there that one tries to hit. And in fact, it has worked for Abraxane. Abraxane is probably today one of the most successful nanodrugs, and it's based on the use of albumin as the nanoscaffolding. And of course, it's good news to everybody in this room that dendrimers have the right dimensions. They're small enough that you can engineer them in order to hit that sweet spot. Now, having said that, let me correct one other issue that showed up in Zanka Svensson's review. And he questioned, was it taking too long for dendrimers to get to clinic? And I did go back and do some research and compared it with Chezi Barinholtz. And it appears that the very first nanodrug that was approved, namely Doxil, took a total of 34 years from the first time it was published till 95 when it was finally approved. And dendrimers so far are pretty close to that. In fact, Star Pharma has their first approved dendrimer-based drug. It's an ex vivo, it's a topical, and it's being used on condoms which will, I understand, be available for the Olympics, they claim. That's what it shows up in the US newspapers. And so it's an ex vivo antiviral, and they are also making substantial progress with their in vivo DEP therapy, which involves their polylysine dendrimers, and they are in phase 2 and phase 3, and all of the indications are very good. They have almost completely eliminated neutropenia and other side effects, so it has very good signs at this time. Now, we all know that clinical trials are usually thought of in 3 phases, and the first phase usually is all about designing a formulation that will give you acceptable acute nanotoxicity. The second phase is strictly about efficacy. How well is your drug performing against other known or other competitive options? And so phase 2 is always usually a test of how well you've engineered the features that make your drug ideal and the best. And of course, the third phase and the fourth phase deal with chronic nanotoxicology, things such as complement activation, off-target and side effects, etc. So once again, we take a look at that simple recipe. If we design the CNDPs properly and we have the good quality to go with those proper designs to get good quantitative nanostructure activity correlations, then you have the potential for high success in a clinic. Now, let me give you just a couple of slides on what CNDPs are about, because it's very simple. It's not a complex idea. I've been talking about it for over a decade, and it simply involves manipulating these 6 simple parameters shown here that are associated with literally all of the quantized building blocks, all the way from the atomic level to the molecular level to the nano level and beyond. And I don't have time to go into great detail, but other than to say that dendrimers right now are probably the most easily engineered nanoparticle platform known so far. In fact, we find that these correlations really follow after early correlations made by Mendeleev with using our elemental atoms and how they come together to produce very predictable molecular level materials that we have been using in the traditional pharmaceutical field for years. So now we extend many of those principles to looking at how to unify and how to put together a unifying picture for nanoparticles that might be similar to the atomic level or the molecular level organizations we've used in the past. We know at this time, and if you have a chance to take a look at this review article, we know that many of these quantized nanoparticles that we're very familiar with are going to be the building blocks for a new area that is evolving called meta-atoms. and our Department of Defense is very actively involved. They use meta-atoms to make invisibility cloaks. So someday you're going to have cloaks where I can be up here talking, you won't be able to see me. They will be based on meta-atoms. And many of these quantized nanoparticles will be used as the building blocks. Now, with that background, what we are doing in our laboratory and other people that I work with is we are trying to understand what are these nanoperiodic property patterns, how do these very well-defined and quantized nanoparticles that include hard as well as soft, I'm going the wrong way, that include hard as well as soft nanoparticles, how do they come together in these special relationships to make nanocompounds? How can we engineer them to optimize them for special jobs and special applications in the clinic? And I'd like to, at least at this point, share with you that the physicists have now come on board, and we're very actively involved now in this project and this concept. So it's not just a project initiated by and supported by chemists. It's involving many well-known physicists out there, which we won't have time to talk about today. Now, just to give you an idea how we do these engineering events on Dendrimer CNDPs, I'd like to have you take a very brief look at the 6 parameters. They include size. We already saw size is very important to get into the cancer tumor and penetrate deeply to deliver the drug. They are dependent upon shape, and especially on surface chemistry, on flexibility and rigidity, on the elemental composition. And you're going to hear about some other phosphorus compositions today that show that they indeed have unique properties that are different than many of the more traditional PAMAM type dendrimers, and of course, and finally, architecture. Now, I'd like to point out that 4 of these soft nanoparticles, or soft superatoms, have really had some kind of success or play in the clinic. And just as an update, I mentioned that Vivogel has already been approved for topical applications. They are in phase 1 and 2 for the injectable DEP type cancer therapies. And Bine, we know as of recently, that has had some serious problems, probably based on the fact that they did not properly engineer the sizes. And they may be a little bit too large to get the job done. And then finally, this is probably one of the most successful nano drugs involving the conjugation of PEGs to protein, various protein drugs, and they have been approved for, as you can see, many, many years, shown here. Broxane, I'll show that in the next slide. Broxane is probably the most successful nano drug, and of course, the platform was designed by Mother Nature, and it's about an 8 nanometer platform, so it does many of the jobs that the Broxane people have been working on in the clinical and development of their commercial products. It has really served them well because it really has this nice, roughly 8 nanometer dimension that I talked about earlier that fits that sweet spot that we discussed in the second slide. Now, coming to the other category of drugs, namely PEG protein conjugates, they are a combination of a soft, linear PEG superatom with a protein in many cases, and they've been around since the 90s, and they are still active. However, recently, concerns have been raised by the fact that these materials are giving very strong immunoresponses, so there is indeed a quest for new alternatives. Now, having said that, I'm going to have to go through very quickly because I'm running out of time. We have, in fact, engineered a PAMAM dendrimer using the CNDP engineering principles, and we've engineered sizes, shapes, surface chemistries, and we've come up with a new approach to an alternative for pegylation, and then we refer to it as pyrrolidinylation. And it shows up in a patent described here on this first entry. And in fact, this patent will be a part of the IP that supports many important activities in the Cosmophos project. And Panos and I have had good discussions about that, so a lot of his protection will be in this patent right here that will make certain that many of the things he wants to do in clinic is properly covered by intellectual property that he owns. Now, very quickly, the second issue, that is quality. I have only one slide to show you, and I think it tells the whole story. If you don't have reproducible, if you don't engineer reproducible quality in your nanoparticles, it's very tough to get to your clinical studies. It's also very tough, in my opinion, to reproduce results in the literature. So I'm getting very tough, not only as an associate editor, but as a reviewer. And let me just point out that these are the dendrimers. We believe at Nanosyntons, where I work, we believe we make the most precise and most highest quality dendrimers based on these electrophoretic pages compared to Dendritech. And this is a page of their generation 6, and as you can see, it has many things down below it. It should look like this. It should be slightly higher than this generation 5, and it has many other things in it that we can't even account for. And in the second place, generation 4, they have many trailing generations. But if you think that's bad, the Chinese dendrimers that are now coming out from Weihai, from CYD, China, are really a mess because we can't find anything other than a complete repertoire of hyperbranched, where you have every generation practically in the spectrum of possibilities. And so this slide should tell it all. I showed this in Montreal last summer. It shocked many people in the dendrimer world, but we've seen this for a number of years, and we are concerned that this may not only cause problems in the literature, but it will cause problems in getting to clinic. Now, to wrap up very quickly, the message is very simple. Engineer dendrimer CNDPs. The 6 CNDPs are here. Try to understand the QN-SARs, the quantitative nanostructure activity relationships, just as we had earlier done over the last 70 years for simple molecular level pharmaceuticals. And the second part is work out the engineering so that you have reproducible dendrimer quality that will allow you to get not only into the clinic, but also have more reproducible results for peer-reviewed publication. I just want to wrap up by saying we have some wonderful collaborations with some major U.S. pharmaceutical companies, with Bridget Voigt and Dietmar Appelhans in the Leibniz Institute, with Barbara in the University of Lodz, Poland, with Pan, and with Valentin here, who has been looking at many of our things. And I'm out of time. Fast acknowledgements there. Any other questions? Go to chapter 8 or other parts of the book for more of your answers. And I think I'm out of time and probably don't have time for questions. I'll hold them to the end, if that's all right, unless there's somebody who has a very quick, brief one. And I'd like to introduce Professor Barbara Kleinert-Melowitz, who was my co-organizer of this session. Barbara?